All right, well, other than getting freezing cold, there's a lot more to it. Cold plunge is a modality that's become more popular lately. There's some good evidence for some good effects with cold plunge and some good evidence for some adverse effects with cold plunge. Cold plunge has been shown to reduce the inflammatory process within your muscles after prolonged exercise, which allows for quicker recovery and ability to resume your sport or activity sooner than you would otherwise. Some people also find the acute stress response of being shocked by the cold water to help them mitigate stress response in their daily life. If you can get comfortable and accustomed to the extreme stress response of an 8-degree cold plunge, this or that at work is going to feel far less consequential. So concurrent with the benefit of cold plunge of reducing inflammation in your muscles after exercise, it also reduces the cascade of chemical responses that result in muscle hypertrophy. So if your goal is muscle hypertrophy rather than rapid recovery and resumption of your activity, evidence suggests that you should avoid cold plunging anywhere between the day after exercise up to a couple hours post-exercise. It depends on what your goals are. Let's say somebody's objective with the exercise they're doing is muscular hypertrophy, enlarging of the muscles. If one were to then use the cold plunge immediately after that exercise, they would dampen down the chemical cascade that leads to the expansion of that muscle tissue. Evidence suggests that one of the great uses of cold plunge is to use it immediately after activities like endurance sports or whatever athletic endeavor you're involved in. Cold plunge can help reduce the inflammatory response in your muscles that leads to muscle soreness, allowing you to get back to your sport the next day. And obviously don't overdo it because it can lead to hypothermia.